heading home from the hospital today. I spent the entire day in the operating room, which is pretty cool. This is my second day on the service. I really love this preceptor. I noticed this is a good preceptor. Really lets the fellows, I don't get to operate obviously, but really lets the fellows get involved and patiently take their time. I got to scarf in a couple times and do my due diligence squirting the wash, as they call it. But I liked it. It's definitely interesting. I like the environment because it feels very team-based. Yeah, these were really satisfying procedures to watch. This particular preceptor said his favorite procedure was the repair of a retinal detachment after a cataract surgery because that's the most satisfying in terms of people getting their vision back. The fellow talked to me about learning, like, for people to be able to do surgery, they need to be able to accept, like, walk past, like, being able to not get upset about things not going right or complications. And so that was something to think about. It's kind of interesting. I'm meeting all these fellows or people who are going to go do fellowship in like Australia or New Zealand, or people came here from another country. So I kind of hope that I will be able to have an experience of, you know, going somewhere to another country and maybe doing a fellowship, which is... This rotation has been amazing so far. This morning I was in the wet lab and I did 3 sutures up to the smallest size of 8/0 on a real human cornea. It was actually really hard to work with. It was very delicate, and so I learned some lessons about like going slow, going careful, and that's how you win the race instead of trying to make a lot of like busy movements or moving too much. However much actions you can save, the better. But it's just very cool, and I felt myself do a bit of progress, and I'd be really excited to learn how to do these even better, like do the real thing. The only thing I did today was put in a suture and then tie it, but still super cool. I don't have enough words to say. And then in the afternoon I was in the emergency clinic with the residents. They were super nice, and I got to see one case, kind of work it up myself. I think I did pretty good. Like I did pretty good with the slit lamp. Now I can see pretty well with the 90D. You know, I can do all the checking stuff, history, and I was actually able to pick up some things, but I didn't trust myself. I didn't like totally report them, but I got to pick up on, like, I was managing to pick up on the peripapillary atrophy. I did pick up that the cornea was a bit weird, but I didn't, like, I actually dismissed myself, and in the end it turned out my resident said there is actually something abnormal about it. I did my best attempt at an indirect periphery exam. I saw stuff, but I wasn't like good at it, so that's really something that's something I want to work on and get much better at skill wise. And then I'm gonna just feeling really motivated and excited. So yeah. Hello, today was a day in the operating room. Looking a little messy here. And then, yeah, one thing that I found really helpful that I wish I've been doing for every surgical rotation, but I want to make sure I do for the next rotation, is basically like go in, make sure you learn all the tools and all the steps, and then what tools are involved. So, for example, the first time I scrubbed in, she asked me to name the different tools. Like, what tool are we using? No, so first time is what step are we doing, and the second time is what tools are we using, and then the third time it's like, okay, she's like, imagine you're the surgeon, or imagine you're the cyst. You line up all the tools exactly, like know exactly what tool I'm going to use next. And so that was really helpful because, you know, it takes me, like, I would say 2 tries to get it right. And then it really solidifies the knowledge for me, and it keeps me really engaged in the surgery, realizing, like, thinking like, if I were the surgeon, what do I need next? What is the next step of the surgery? What tools does it involve? And it sounds really easy, like, but then actually when you do it, it really solidifies. So anyway, so now I really feel like cataract surgery got the tools, but then it's not always like I'm gonna get it, because some different people do different tools, and so it's something that I just need to read up some details on the different viscoelastics, and then apparently there's a lot of different techniques to remove the cataract. And so anyway. I just attended a residency session that I'm really excited about. The program sounds like really nice, and I mean, one of the sessions I was like feeling kind of awkward at the beginning, and then like when you do little breakout rooms you have to ask questions, but the second one I felt like The residents were super friendly, and I think we just had all of us, like me and the other med students, we just like warmed up in terms of like questions. And so I don't know, I really like this program, and it's not too far from home. So I think I'm going to rank this program highly, and I'm kind of interested in it. So we'll see how that goes. Oh, but like, it's hard to say because I feel like every time I go to a session, I keep saying like, oh, I want to rank this program top. And it's like, I think it just goes to show that like, I do think each program is like different, but I actually find something that I love about each program. And I was just talking to a mentor today that like, number one, if you really want to become an ophthalmologist, the program doesn't matter. And so that's true for me. I'm really willing to go anywhere. And what makes me feel soothed by that, like I'm already willing to go anywhere, but I think I really love that all the programs that I listen to, like I seem to love them. And I think I would hopefully if they like me too, I hopefully see myself like really vibing with people. And yeah, anyways, now I need to get my button to here, and then so today we were in the OR, and so tomorrow we'll see all the patients that we saw my preceptor operated on today. So I'm just going to read about some post-operative care. This is some routine post-op cataract care. So people that are visiting tomorrow should actually have 20/40 or better with pinhole, which is pretty amazing. So I'm excited to see that. We'll expect to see some corneal changes, some salon flare. I should look up how to grade that properly because I see it and I'm not that great at grading it, but kind of that first visit week 1. So that's going to be my learning goal for the next like 30 minutes, to just like really get it into my head, like what to be looking for post-op. Good morning. I woke up at 5 to do a presentation at Brown's today, so I was kind of nervous for it, but it was good. I thought I was going to be sleepy, but I think the presentations were like very interesting. I love that within ophthalmology today and yesterday when I was watching Grand Rounds, I was just like, there's so much excitement about innovation. How can we better improve surgery, answer all the questions that are unknown. Yesterday's presentation was really cool. It was one of the surgeons was presenting about like a very novel technique, and it's very controversial because it's very innovative, but it's very invasive, and it might be better, but it might not be. And people are very very committed to a kind of the existing method, which is imperfect. And then today was just like answering a lot of unknowns, and then questions like, well, should we be doing this? And then someone else is, this study in another country is trying this. Should we try this here in Canada? I think that's very exciting about all the innovation, and I love that. So this is why I like research so much. It's so innovation, but also the field itself, just as surgeons and clinicians asking questions, how can we do better all the time? Smile.
Because they have expertise like
Alright, Eli, want to say something?
I thought you were gonna chuck it at you.
Welcome to my birthday party. Are you back to the...
I think spot it. Or are they just like melting?
Is this a video or photo?
Oh, sorry.
Wow. That's fancy.
Whoa!
I want to eat it right now.
Are we gonna sing?
Alright, happy birthday to you. Happy birthday to you. I don't know, get over there.
Happy birthday, dear Dad. Happy birthday to you.
We were on call today, and I thought ortho was light call, and no, we had almost like we had 20 on-call patients in today, and of course I am like didn't eat most of the day, and I realized that there's no need to. I feel like I wanted to like prove myself, prove that I'm hardworking, and that I won't eat until they were out of patients, and then the patients never ended. And I wish I could talk. I'm gonna do next time, and I hope others, like other med students like me, like it's not worth what I'm not sure what I'm trying to prove. That I wish I just like had taken some time. Like I could have like swallowed something. Like I was eating like cookies, like thank you for cookies, and I was just like breaking off little bits as I had time to eat them, and that wasn't really filling. I think would have been nice to just like take 10 minutes and just gulp down like a soup or something. It was my party with my friends, and life just seems all good and blissful. And today was blissful in a different way though. I had so many patients that I loved. Like I actually like the on-call because like it's just like very interesting the type of stuff you see. Like General has this thing, like we were seeing a lot of diabetes checks, glaucoma checks, cataract consults, cataract follow-ups. But this is like super interesting to see like stuff that you read a lot about in like textbooks, like ankle closure glaucomas. You see a couple, you see rare like side effects, you see like trauma type incidents, you see kind of first presentations of stuff, and you kind of really work your differential diagnosis brain. So I did really like it, and a lot of patients, like I have a thing, I love elderly patients so much. It's probably why this field suits me, and why I like family too. Just like I love old people. They're just so funny, so many inside jokes, and just like their casual carefree attitude, and you know, and them being really understanding that we're busy and on call. And yeah, like even though I felt like really hectic at times, like when I was with patients, I felt like I was slowing down, like taking the time to examine, and I learned lots of things, and also like them telling me random tidbits. They're just like, this is so unrelated, and like one of the ladies just was telling me like, this is unrelated, but randomly like my porch roof broke in, and it was like she just like has like, and then a lot of them have like these hilarious senses of humor, like a little dark humor, but it's, you know, I like it. He's gonna introduce these dishes. We're having Chinese Korean.
Yeah, today Chinese Korean fusion place here. So this one's a classic called jampong, but it's a special one because it's samseon, so it means there's more seafood, more proteins, and then there's also 탕수육. So this is another like very classic Korean Chinese fusion, and it has the sweet and sour sauce that goes with it. Yummy, yummy.
Today we were in the OR. The advice I got from my supervisor for med students and residents is, this applies to ophthalmology, but I'm sure it applies to basically most other fields, is to always do a thorough exam. Make it my goal as a med student and a resident is every single time take it from head to toe for my learning, just so I develop like a very systematic approach. And the more I do my exam, the more I get faster and good at it, and learn how to pick up normal versus abnormal. And then just like as a student, as a med student, pick every single thing up, and then learn from getting feedback from a staff. Is that like, you know, relevant, or is it just a variant of normal? But you know, always do it. It's really tempting to skip steps, but that's not really something you should be doing until you're staff. So if you're looking at the retina, look at everything from the anterior chamber to the lens. If you're just looking at the anterior chamber, if it's dilated, look at the back, look at everything, test everything. And because when you skip steps, that's what you get into trouble, and you make the wrong diagnosis. And then sometimes you need to maybe be more thorough about ordering investigations, and yeah, be careful and don't miss things, and yeah, and don't hammer in too tightly on like one diagnosis too early on. He's so cute.
Part 1. Who thought of this? Part 2. Who integrated Cooler Code? I did. God.
Your brother is a genius.